Hello, I am Dr. Mohan Raut. Welcome to today's live presentation. I welcome all my viewers from LinkedIn, Facebook, as well as YouTube. And today I am going to speak on a very clinical, practical topic, and that is I am going to discuss some of our cases who have been benefited by the ImmuLIT treatment that we have done. Why I have chosen this topic is because many times patients ask us, Doctor, I have this problem, I have so many miscarriages, I have so many failures, I have miscarriages at 6 weeks, 8 weeks, at 18 weeks. Will this treatment benefit us? So, this in this program, when I discuss these different cases, I think they will relate better with these patients and correlate with their problem. So, as I said, I am Dr. Mohan Raut. I am a gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai and in many other parts of India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using our patented process of ImmuLIT, followed by certain immunomodulatory medications. So let's come to today's topic and the interesting cases that have been treated with ImmuLIT and who are successful. I am going to discuss these cases in 6 groups. So what are these 6 groups? The first group is of patients who had repeated miscarriages. Second group is the group where patients had recurrent repeated IVF failures. Third group is a group of patients who had unexplained infertility. They had not undergone more advanced treatment like IVF. The fourth group is those who had late pregnancy losses. That is the in the second trimester or late early third trimester. And fifth group is patients who received ImmuLIT treatment during pregnancy. And the sixth final group is those patients who had taken lymphocyte immunization therapy at different centers and still were not successful. So let's come to first group, the group of miscarriages. Miscarriages is a very common problem. It's devastating when it occurs repeatedly. And you know that almost 2 to 5%, at least 2% of all couples in reproductive age group suffer with repeated miscarriages. And almost 50% of these couples, in those cases, the cause is not found and they are just labeled as unexplained. So it is in this group of patients that the alloimmune factor or the immunological factor can exist, or highly likely it is there, and these patients are benefited by the immunological treatment of ImmuLIT. So I remember one patient at the beginning of my practice. This patient had called us up, found us on internet, and called us and sent an email. She had 15 miscarriages. So she had been taking treatment in different parts of Europe. She had say 8 miscarriages with natural conception. Then she stopped conceiving. She landed up with infertility. Then she started doing IVF. She underwent 9 IVF cycles, of which 7 times she conceived and she miscarried. All tests, routine tests were done related to miscarriages and everything was normal. But she was searching on internet and she found out about us and our work related to reproductive immunology. And after that email, she contacted us, she came here, she got investigated. It is very important. These investigations are very important, and these certain investigations like lymphocyte cross-match, NK cells, TNF alpha, antithyroid antibodies, these are done for all patients, and only if these tests indicate, the couple is recommended this treatment. So this couple was going to be here for 1 week. So in 1 week, they initially underwent the investigations. Later on, they took the treatment and they flew back to UK. Now they carried certain medications which we recommend with them, and from there they were in touch with us. And believe me, after that she had 9 IVF cycles, and twice she had never conceived in that cycle. She conceived naturally. The pregnancy was uneventful, and she delivered a full-term baby boy who is now, I think, must be 10 years old or 8, 9 years old, and mother and baby child are absolutely healthy. So similarly, I remember one more patient. Why? Because she also had 15 miscarriages, and that story was really, I would say, sad. The couple had come for sterilization. They said that we want to undergo sterilization. I asked them, how many children do you have? And they said, we don't have a child, but my wife has 15 miscarriages. So I don't want her to face the 16th one. So we explained to them about what we do, and we investigated them. And luckily, they agreed to the treatment. And after the treatment, she conceived naturally. Pregnancy was little stormy. These patients who have immunological problem, they tend to have little stormy pregnancy because the immunological attack, yeah, if the pregnancy escapes the first trimester, then the attack can occur little later, around 18-20 weeks of pregnancy, and these patients can land up with early onset preeclampsia. So therefore, she developed symptoms related to preeclampsia, and I think she delivered little prematurely at, I think, 32 or 33 weeks, but she had a healthy baby girl, and that girl is now quite big, and the family is really happy. One more case related to miscarriage I remember, because this patient had 5 miscarriages, and they were told by doctor that you will not be able to carry pregnancy, and you will have to undergo surrogacy. So the couple was not keen on, they didn't want to undergo surrogacy. They said, we afford, but we don't want, because I feel, the husband was very keen. He said, I feel my wife will carry the pregnancy. So can you help us? So again, we explained to them the possibility of immunological problem, and they were willing. They were staying far away from Mumbai, but they came all the way, or did all investigations, came for the treatment, did the ImmuLIT treatment, and yes, in 2 months she conceived, and the pregnancy was uneventful, absolutely no problem, and pregnancy went till term. And I think that couple was so happy that they sent a video of both of them with the baby, and how happy they are, and how this treatment was helpful for them. So yes, patients who have repeated miscarriages where the cause is not clear, it is important to think about immunological factor and get the investigations done, and if required, the immediate treatment followed by the immunomodulatory medicines depending on the immunological test reports are beneficial. So there are so many patients with repeated miscarriages who have visited us, and many of them have been benefited. So this is one group. If I start telling about miscarriage patients, then the 1 hour or maybe it will go on. So the second group, I am coming to second group, that is IVF failures. Now there is a large group of patients who undergo IVF and they don't succeed. The statistics says that almost 10% of couples who have been undergoing IVF land up with recurrent IVF failure, and many of them, the exact cause is not known. So these are again labeled as unexplained, and then more IVF attempts are made. So in such cases, again, there is high chance of an immunological factor, because the process of implantation has immune system plays a huge role in the process of implantation. So I remember here one couple, they had undergone 6 IVF cycles. They had never conceived. So when they called us and inquired about it, they were skeptical. And they said, yes, we have read about this, we have heard about this, but are you sure this will definitely help us? Is it 100%? So we explained to them that, see, in medicine, you all will agree with me that nothing is 100%. But yes, if we try and do our best, rule out all factors that are responsible for the problem, then yes, we can increase the chances of success. So we explained to them. The couple came to us. The investigations indicated that the problem was immunological, and they underwent lymphocyte immunization therapy. Now, after that, the couple went back to their IVF doctor. As you all know, we don't do IVF, we do our focused work in reproductive immunology. So they went back to their IVF doctor. The patient had never conceived. There was never a single implanted embryo in all these so many 6 IVF cycles. So there were 4 embryos which were frozen. So the IVF doctor decided to put all 4 because at least one will get implanted and the chances will be better. To the doctor's surprise, all 4 embryos got implanted, and finally the patient had to undergo embryo reduction and keeping twin pregnancies, and which went on successfully till term, and now they have twin babies. So yes, it is important to know that if this unexplained IVF failure has immunological factor, then this treatment is helpful. One more patient I remember, she had come from the other end of the far east part of India, and she had been taking treatment in different parts of India, undergone 4 IVF cycles, and they had failed. So the last IVF center where she went, the doctor recommended that yes, there can be an immunological factor. So please see Dr. Raut and see if that is possible. So the patient came from there to our center. Patient waited till the reports came, and immediately in couple of days she went ahead with the ImmuLIT treatment also. She was to come back for her IVF treatment after 2 months, so she went back to her native place. After 2 months, she called me up and said, "Doctor, I am pregnant." I said, "Very good. When did you do the IVF?" She says, "Doctor, I didn't do IVF. I conceived naturally." So, yes, so this patient had unexplained infertility. She had never conceived naturally. With IVF also, she never conceived. But after correcting the immunological factor, she conceived naturally. So, here thing I would like to stress that it is very important to rule out all other factors when we are treating infertility. And many a times, a treatment which is given earlier, even before IVF, can be helpful to these patients. So this brings me to the third group of patients, that is those with unexplained infertility who have done a lot of ovulation induction, or maybe some of them have undergone IUI, but they have not been successful, and now they are going for IVF. So at this stage, there are a group of patients who have come to us or who have been referred to us even by IVF centers before doing IVF to check or to rule out whether there is an immunological factor in that case. And I remember one patient who had endometriosis, who had severe endometriosis. She had undergone the ovulation induction studies, IUI. She was not successful. She was referred to us by a doctor, IVF specialist, and she required immunological treatment. She took the lymphocyte immunization therapy, and afterwards she conceived naturally. And after the doctor herself was so surprised that she said, "This is for her." She said, "This is like a miracle because she had quite severe endometriosis." Of course, I told her this is not the treatment for endometriosis. This is an immunological treatment. But yes, endometriosis has a lot of immunological element, and many a times the alloimmune problem coexists with endometriosis. And if we correct it, then there are good chances. Of course, the other part of that, other things that are required for conception should be there normally. And this patient, interestingly, conceived second time after a few years naturally, and I think she has completed her family also. So this is a group of unexplained infertility patients who can benefit even before more advanced treatment. So we can keep this thing in mind and think about immunological factor even before IVF. The fourth group, now let's come to the fourth group. These are the patients who had late pregnancy losses, maybe in second trimester. So I just mentioned in one of those cases that if the patient escapes the immunological attack in the first trimester, then this can happen. The attack can occur in the second trimester, usually around 18 weeks or 20 weeks, because this is the time when there is second wave of placentation. And if at that time if there is immunological attack, then the placentation is poor. and that leads to poor vascularization, poor blood flow to the pregnancy, which leads to intrauterine growth retardation or oligohydramnios. There are increased incidence of preeclampsia, early onset preeclampsia, leading to sometimes IUFD also. So these patients also have an alloimmune problem in those cases. And I remember one distinct patient, I can't forget. She was referred from interior Maharashtra, around I think 200, 300 kilometers, 300, 400, 300 kilometers from Mumbai. And her doctor, a gynecologist, called up and said, Doctor, this patient had three IUFDs. Three times the babies have died at around 20, 21 weeks. All the three times she developed high blood pressure, swelling. The baby did not grow, the fluid around the baby decreased, and the baby lost the baby. So, and when she called up, this patient was almost 8 to 9 weeks pregnant. So we explained to the doctor and explained to the patient online that this is what is possibility, and we can, if the reports indicate, then we can treat you by immunological treatment. So this patient came by road, traveling overnight to our center. She underwent investigations, followed by the treatment, and this was followed by immunological medications. And I'm happy to share with you that this pregnancy continued till term, and they have now a healthy baby boy. So I'm not saying that in 100% all cases of preeclampsia or PIH, this is the treatment. But yes, those specific cases of early onset preeclampsia, where there's high chance of alloimmune problem, where these patients are really helpful. I remember one more patient, I think they had two pregnancy losses around the same time, I think around 18, 19 weeks, and very well educated patients, highly placed, and they were so anxious that they didn't want to plan pregnancy next time, the third time. So we explained to them everything, we investigated them, they required immunological treatment, ImmuLIT treatment was given, and then she conceived naturally, but they were so anxious that every week they used to come to check fetal heartbeat, and especially around 18 to 20 weeks or 24 weeks, they were so anxious that twice a week they used to come and check the heartbeats. But this pregnancy went on smoothly till term, and they have a healthy baby boy now. So why I'm telling you about this is, yes, there are definite causes of pregnancy losses in the late part of the pregnancy. The Apla syndrome, that is thrombophilia related problems, autoimmune problems. So all these can lead to late pregnancy losses. But yes, along with these important causes, we must also remember an alloimmune factor in these patients. So many a times, those with Apla syndrome, when we treat them with heparin and ecosprin, still many times they fail. The pregnancy still miscarries. And so in these cases, it is important because many times the autoimmune and alloimmune factors coexist. So we must remember to take care of these factors. So this was the fourth group of late pregnancy losses. The fifth group is those patients who were given ImmuLIT treatment during pregnancy. Now, yes, ImmuLIT can be given in pregnancy also. So there are patients who present with pregnancy or with history of say multiple miscarriages in the past, and they require immunological treatment. I remember one patient, our teacher, Dr. Usha Krishna, had called up one day and said, I am sending one patient, see if you can help her. She has 6 miscarriages and now she is pregnant. She is 5 weeks pregnant. And do you think this treatment will help? So when they came, entire family was there, around 10 people were there with the patient, and we explained to them about the immunological part, and then she underwent the investigations, followed by in 2 days the treatment. And I am again happy to share that she after the treatment, she took the immunological medications religiously, and the pregnancy smoothly went on till term, and she had a healthy baby. So why I am sharing this is, even when the couple is pregnant and the investigations indicate this treatment can be beneficial. Of course, now we have done in many patients during pregnancy this treatment. Not all are successful. Recently, we treated one patient where the patient had come at I think 9 weeks and already had bradycardia, and we explained to them the investigations indicated that there is immunological problem, but we gave the treatment, but the pregnancy was not successful. So I think we were a little late in giving the treatment because already the effect had the immunological effect was already established, the fetal bradycardia was already there. So if in time it is given in pregnancy, it is still helpful for those patients who have this problem with the history of unexplained miscarriages. So that was the fifth group of ImmuLIT. We have given, I think, more than 14, 15 patients now. One of the patients was even had come through in ambulance with a threatened abortion, and then that was treated, and that patient has done well. So that is the fifth group. And the last group, here I would like to share, especially I want to share because as the practice of lymphocyte immunization therapy is increasing, there are, we come across patients who have taken lymphocyte immunization therapy at other centers and they have not done well. See, this can happen with anyone. And the patients we treat are also not 100% successful. There are patients who fail, but we have realized that certain patients who have come with failure even after the LIT procedure done at other places, the investigations indicate that they will benefit with lymphocyte immunization therapy, and we have given treatment to them and they have been benefited. I remember one patient from Delhi, and she had undergone 4 IVF cycles and all 4 had failed. In between, after 3 failures, I think she had taken 5 rounds of lymphocyte immunization therapy, and still the pregnancy had not, the next IVF cycle had failed. So we explained to the patient, the patient was reluctant. She said, what different you are doing, because I have taken it 5 times. So we explained to them what we do, and then we investigated her and she required the treatment. We gave her treatment. And I am again very happy to share that in 3 months, the patient called up. She says she's pregnant naturally. So she had a natural conception. The pregnancy went on without any problem, and she had a healthy baby. So why I am sharing this is because it is important that even when a lymphocyte immunization therapy has been taken once, we found that the way we are doing our treatment, our patented ImmuLIT process, these patients are benefited. There are quite a few patients like this, and who have we had to do rather redo lymphocyte immunization therapy, and they have been benefited. So I told you about these 6 group of patients: those who have repeated unexplained miscarriages, IVF failures. Third is late pregnancy losses. Fourth is unexplained infertility. Fifth is ImmuLIT given during pregnancy. And sixth is those who have previously taken LIT and lymphocyte immunization therapy, not ImmuLIT, and they are not successful. So these 6 groups cover almost all patients who have unexplained pregnancy loss, unexplained infertility, or unexplained, as we call, reproductive failures. So it is important in these patients to think about alloimmune or immunological factor first. Second, to get the investigations done. And third is get the treatment done. So I think if you have any queries, I think there are certain questions which have come up. So here, Neil Kamal has said that TNF alpha, just a minute, I can. Missed miscarriage में TNF अल्फा क्या है या इसका ट्रीटमेंट क्या है? TNF अल्फा 14.4 है, प्रेगनेंसी प्लान कर सकते हैं क्या? तो नील कमल, अगर आपके केस में, आपकी हिस्ट्री में, अगर आपको मिसकैरेजेस है पहले या आईवीएफ आपका फेल हुआ है, तो टीएनएफ अल्फा का सिग्निफिकेंस है. टीएनएफ अल्फा कौन से लैब से क्या है उसके ऊपर भी है. द नॉर्मल रेंज इन सर्टन लैब्स इज अप टू 8.1, while in some labs it is 12.4. So in our case, your case, it is marginally high. So just on TNF alpha, I may not be able to comment, but we'll require other tests to know whether you will require an immunological treatment before planning pregnancy. If it is natural miscarriages, then whether to try naturally, and if it is IVF failure, then whether to undergo IVF. So that was Neil Kamal. Then I think one more question has been asked by Mr. Abhimanyu. What is the role of TNF alpha in pregnancy? Actually, TNF alpha is a cytokine. It's a chemical produced by white blood cells, and it's a destructive cytokine, or in medical terms, it's an inflammatory cytokine or Th1 cytokine, and which is important part of our immune system. It is important for the different immune mechanisms. It helps in clearing the infection. So it is important, but if it is high without any apparent reason, and if it is associated with reproductive failures, then definitely it has an impact on pregnancy. It may cause implantation failure, it may cause miscarriages. So very high TNF alpha is very commonly seen with reproductive failures, and it requires immunological treatment of ImmuLIT followed by immunomodulatory medicines. So after how many IVF failures should I consider lymphocyte immunization therapy? Someone has asked. So it's not after how many. What is your problem that is causing the IVF failure? That is important. If there is a genetic factor, then that has to be corrected. If not, if everything is fine, then of course, yes, immunological factor is to be corrected. So I would say there are many other factors that we'll have to consider, because even after one IVF failure, also it will be required to check immunologically. If everything, according to IVF doctor, everything was normal, embryo was genetically tested, lining was good, everything was good, and still the pregnancy was implantation was not successful. Yes, in that case, maybe very early. And as I mentioned in one of the cases, even before IVF, if that factor can be ruled out, it is still better. But yes, it is important to think about it. Only then you will act on it and help the patients. Will be doctors can help patients, or patient can accordingly consult doctor and take the required treatment. So I think I will stop here. If there are any queries, any questions, you can contact us on our helpline number 9833201522, or you can visit our website www.icprm.in. So again, I will stop my presentation here, and I will urge you to what you have listened today, share with those who are facing these problems or who are looking for solution to their similar problems, and I am sure you will change the life of that person and help them to complete or fulfill their dream of baby. Thank you.